Did you know that the very first hour of your day, that precious time right after you open your eyes, could be silently determining the future of your heart health? It's a startling truth many overlook. Your familiar morning routine, the one you've performed for years, might actually be a minefield of hidden risks for your heart, especially if you're navigating life over 60. Perhaps you've been feeling a bit more tired lately, a little breathless on the stairs, or maybe you've noticed your blood pressure creeping up despite your best efforts with diet and medication. You might chalk it up to just getting older. But what if I told you that some of those harmless things you do before your first cup of coffee are unknowingly chipping away at your heart's vitality day by day? You're not alone in this. Millions of seniors are unknowingly engaging in these everyday actions that, over time, can lead to serious cardiovascular strain, increased risk of high blood pressure, irregular heartbeats, and even a higher chance of a heart event. The frustration of not knowing why you're not feeling your best, despite trying, is a heavy burden. But here's the empowering truth. Knowledge is your greatest defense. In this video, I'm not just going to list problems. A specialist deeply committed to senior heart health, and I'm going to pull back the curtain on these 5 widespread bad morning habits seniors often ignore. More importantly, I will equip you with simple, scientifically backed adjustments, over 60 heart tips straight from years of heart surgeon advice that can transform your mornings from a source of hidden stress into a powerhouse for heart disease prevention. By the end of this video, you'll understand exactly how to reclaim your mornings, boost your energy, and truly protect your heart after 60, paving the way for a more vibrant, confident, and heart-healthy life. Stay with me, because what you learn today has the power to change everything. Now, let's talk about fuel for the new day. I understand many of you, especially those of us focusing on senior heart health, might not feel hungry first thing in the morning, or perhaps you believe skipping breakfast helps with weight management. But could this seemingly harmless routine be one of the bad morning habits seniors are practicing that silently impacts our cardiovascular health? The answer might surprise you. After a long night's rest, your body's blood sugar levels are at their lowest. Skipping breakfast forces your body to release stress hormones like cortisol to maintain energy. This prolonged state not only temporarily raises blood pressure, but can also lead to fatigue, irritability, and cravings for unhealthy snacks later in the day. More significantly, studies from the American Heart Association have suggested that regular breakfast skippers may have up to a 27% higher risk of developing heart disease compared to those who eat breakfast consistently. And here's something you might not know. For older adults, maintaining muscle mass is crucial for preserving strength and mobility. A protein-rich breakfast doesn't just provide energy, it's an essential building block for protecting and developing muscle, helping to combat age-related muscle loss, or sarcopenia. Research published in the Journal of Gerontology Series A indicates that distributing protein intake throughout the day, starting with breakfast, optimizes muscle protein synthesis in older adults. This is vital for heart disease prevention as overall strength supports an active lifestyle. So, what constitutes a golden breakfast for your heart? It doesn't need to be a grand meal. Think simple and balanced. A small bowl of oatmeal with some berries and nuts for excellent fiber. A hard-boiled egg with half an avocado for protein and healthy fats. Or even just a serving of plain Greek yogurt with a little fruit. The key is to gently kickstart your metabolism, providing sustained energy for the morning. This is an essential part of a morning routine for seniors aiming for a healthy senior lifestyle. Consider breakfast not just as refueling, but as an act of self-respect, a declaration that I choose health, I choose vitality. When you nourish your body with a wholesome meal, you're sending a loving message to your heart. This is an important aspect of cardiac care seniors that we sometimes overlook. Let's move on to our third morning shift, focusing on how we hydrate, a simple yet profoundly important aspect of your morning habits for heart health. Many of us reach for a glass of water first thing, which is excellent. But the temperature of that water, especially for those of us embracing life over 60, can make a difference. The allure of an ice-cold drink, particularly on a warm morning, is understandable. However, this can be one of those subtle, dangerous habits after 60 that might not be serving your senior heart health optimally. Here's why this matters. As we mature, our blood vessels may not be as flexible as they once were. Some physiological studies suggest that ingesting very cold liquids can cause a temporary constriction of these blood vessels or trigger a vagal response, which might briefly alter heart rate or even blood pressure. While this might be insignificant for a younger person, for a senior, especially if there are underlying cardiovascular concerns, it's an unnecessary jolt to the system. Furthermore, chronic mild dehydration is a surprisingly common issue among older adults. The National Council on Aging notes that dehydration can lead to significant complications, including urinary tract infections, electrolyte imbalance, and even falls due to dizziness. When you're dehydrated, your blood volume can decrease, making your heart work harder to pump blood throughout your body. This is a crucial consideration for blood pressure tips seniors should heed. So, what's the gentle, heart-friendly solution? The best morning drink for heart health is often the simplest: lukewarm or room temperature water. Think of it like a warm, gentle welcome for your internal systems. It helps to rehydrate you effectively after a night's sleep without shocking your body. A practical tip is to keep a glass or a small insulated carafe of water by your bedside. This way, it's ready for you at a comfortable temperature when you wake. Aim for at least 8 ounces or about 1 full glass, sipping it slowly as you begin your day. If you enjoy a bit of flavor, a squeeze of fresh lemon can be a lovely addition, but pure, simple water is truly a balm for your body. Embrace this practice, not just as drinking water, but as an act of kindness, an internal anointing that prepares your body and heart for the day ahead. This simple switch is a powerful way to protect your heart after 60 and stands as one of the most effective senior wellness tips for a vibrant morning. It's a small change that yields significant benefits for your overall well-being. Our fourth morning shift concerns a cherished ritual: coffee. But when and how you enjoy that first cup is crucial senior health advice, especially for cardiac care seniors. Drinking coffee before properly hydrating or eating can be a bad morning habit seniors overlook, impacting senior heart health. While moderate coffee offers benefits like antioxidants, drinking it on an empty, dehydrated stomach, common after sleep, alters your body's response. Caffeine can trigger cortisol, the stress hormone. Research suggests this effect is more pronounced on an empty stomach, potentially heightening morning cardiovascular stress for seniors whose cortisol regulation may differ. This can temporarily spike heart rate and blood pressure, a key concern for blood pressure tips seniors aim to manage. Coffee is also mildly diuretic. The American Heart Association notes that if you're already dehydrated, this could briefly thicken your blood, making your heart work harder. Plus, coffee's acidity on an empty stomach can worsen acid reflux for those with sensitive stomachs. The good news? You likely don't have to give up coffee. The simple, heart-conscious solution is the hydrate first, eat a little, then coffee rule. Drinking lukewarm water and having a small, nourishing bite first, perhaps your oatmeal or a piece of fruit, creates a buffer. This simple step helps stabilize your blood sugar, coats your stomach, and lessens caffeine's jolt, allowing for more gradual absorption and smoother energy without those sharp peaks in energy or unwelcome changes in blood pressure. This approach enhances your coffee ritual, making it a more mindful and nurturing part of your healthy senior lifestyle. It's about savoring that coffee in a way that truly supports your well-being. This isn't about deprivation. It's practical heart surgeon advice for enjoying life's pleasures responsibly, ensuring your mornings contribute positively to your long-term vitality and help protect your heart after 60. We've arrived at our fifth and final morning shift, and this one might just be the most impactful for many in today's digitally driven world. It's about what we feed our minds the very moment we wake up. Immediately reaching for your phone to check the news, emails, or social media can be one of the most pervasive, dangerous habits after 60, significantly affecting your morning habits for heart health and overall well-being. In our hyper-connected age, the instinct to check our devices is strong. But when your just awakened brain is instantly flooded with a barrage of information, especially if it's stressful news, urgent demands, or the curated realities of social media, your body can trigger a fight or flight response. This isn't just an emotional reaction, it's physiological. Your system releases stress hormones like adrenaline and cortisol, which can lead to an immediate increase in heart rate and blood pressure. Studies published in journals like Health Psychology have shown that exposure to stressful stimuli, particularly in the morning when our cortisol levels are already naturally peaking as part of our waking cycle, can lead to an exaggerated stress response throughout the day. The American Psychological Association has also highlighted the link between constant digital connectivity and increased stress levels, which can be particularly taxing for cardiovascular health in seniors. This kind of daily, low-grade stress is a factor we want to minimize to help avoid heart attack seniors, as chronic stress is a known contributor to heart issues and can even mimic or exacerbate heart attack warning signs if underlying conditions exist. The beautiful and empowering solution here is to create what I call a sacred 30 minutes, or even just 15 to 20 minutes of screen-free peace at the start of your day. Before you dive into the digital world, allow your mind and body to awaken gently. What can you do instead? Consider quiet reflection or a simple gratitude practice, thinking of a few things you appreciate. Engage in some light, gentle stretching. Look out a window and observe the morning light or nature. Listen to calming music or the sounds of the morning. Or simply sit quietly and savor a warm, heart-healthy drink after you've hydrated and had your small breakfast. This establishes a calm and centered senior health routine. By choosing this peaceful start, you're not ignoring the world. You're fortifying yourself to engage with it from a place of calm and resilience. This conscious choice is a profound act of self-care, helping to protect your heart after 60 and cultivate a truly healthy senior lifestyle. You are taking control of your morning environment, setting a tone of tranquility that can benefit your heart and mind for the entire day. So, to recap our journey to a heart-healthier morning: rise gently, nourish your body with breakfast, hydrate smartly, enjoy your coffee mindfully, and cultivate morning peace before digital engagement. These are essential over 60 heart tips. Remember, significant heart disease prevention often comes from small, consistent changes in your senior health routine. It's about progress, not perfection. Always take your prescribed medications as directed by your doctor as part of your cardiac care seniors plan, and never ignore potential heart attack warning signs. I invite you to join me in a 1-week morning heart challenge. Pick just one of these shifts to focus on this week. Just one. Experience the difference it makes. This is your personal journey to senior wellness tips that work. If you found this senior health advice valuable, please give this video a like, share it with friends and family who could benefit, and subscribe for more empowering content on senior heart health. Your mornings set the tone for your entire day, and indeed for your long-term well-being. You have the wisdom and now more tools to make them a source of strength and vitality. Embrace these changes, listen to your body, and know that every small step you take is a powerful investment in your precious health. Let's make every sunrise a celebration of a heart well cared for. Thank you so much for joining me today and for investing this time in your well-being. I truly appreciate you spending part of your day with me. I look forward to sharing more valuable insights with you in our next video. Until then, stay healthy, stay inspired, and take wonderful care of yourselves. Finally, please remember that the information in this video is for educational and inspirational purposes. For medical advice tailored to your individual health condition, especially if you have underlying health issues or are on medication, always consult with your trusted physician or healthcare professional.